Dr. Eric, urologic surgeon and men's health expert, here to talk to you about penile length. A common question that I get is about increasing penile length. Many guys are concerned that they don't measure up and are interested to know what their options are. In this video, I'm going to talk about what average length actually is, what options are out there and whether or not they work, and finally, some advice on what you can actually do to help with your concerns. Let's talk first about average length. The most common way urologists measure penile length, which, by the way, is only done for studies, is the stretched penile length. The penis is stretched to its maximum length and measured. The average stretched penile length is 5.21 inches. It's important to understand that this is an average, meaning that half will be longer and half will be shorter. As urologists, we're only concerned about the length when it's less than about 3 inches erect. That falls into the micropenis category. On to treatments. So, what's out there? There are many pills and lotions for sale that claim to increase penile length. These usually contain various vitamins, minerals, and herbs. None of these have been proven to work. Another common option is penile exercises. This is often referred to as jelqing. This technique involves using a hand-over-hand method to push blood from the base of the penis to the head of the penis. There is no scientific evidence that this increases penile length. There have been incidences of scarring and pain from jelqing. Similarly, a penile traction device can be used to gently stretch the penis over time. Some small studies have shown true length increase with traction devices. The downside, though, is that the devices are often uncomfortable and need to be used for up to 6 hours a day for months. Penis weights are also a thing. These are supposed to let gravity do the stretching for you. Again, no evidence that they work. Urologists can utilize a couple of techniques for penile enlargement. However, it's important to understand that these techniques aren't typically performed for cosmetic reasons, but instead for men who have a medical issue that has led to penile dysfunction. The most common procedure is cutting the suspensory ligament. This procedure can make the flaccid penis appear longer because it's no longer held up internally to the pubic bone. The problem is that this can make the erect penis unstable. Another procedure is a fat transfer. Fat is removed from one area of the body and then injected into the penile shaft. The fat may spread unevenly, creating a cosmetically disappointing result. The fat is also resorbed over time and disappears, so the enlarging effect also decreases with time. If you search online, you may find a few surgeons offering silicone implants or silicone injections. These options are controversial at best, dangerous at worst, and should be avoided. Devastating complications can result, including infection, gangrene, disfigurement, and loss of the penis. So, what should you do if you're unhappy with your penile length? Probably the most important thing to do is communicate with your partner. If you can understand your partner's needs, then you're likely to improve your sexual relationship much more than you would by simply changing the size of your penis. The next most important thing is to lose weight if you're overweight. For about every 30 pounds that you gain, you'll lose an inch in length. So if you lose that COVID weight, you might find that you regain some of your lost length. Lastly, if your penile length is a significant source of stress for you, then you should talk to your doctor about it. Seeing a therapist may help you improve your body image and feel more confident. Hopefully, this video has given you some insight into the facts about penile length. Please click the subscribe button to stay up to date on my health videos and leave any questions in the comments section below.